I have a couple pieces of tape here on Katie. This is the location of the iliopsoas as it comes across the anterior pelvis. And hip pain that is interarticular generally occurs at this location or more medial. The adductor tendon also comes in medially, and so somebody with a groin strain or interarticular hip pain usually will have pain in this area. Iliopsoas tendinitis will also hurt there. This is also the area where people with hernias, gynecologic issues accounting for their pain, and also lower gastrointestinal pain or kidney stones. They can all radiate pain to this area. This piece of tape here is on the anterior superior iliac spine, and you can go ahead and turn sideways. From here to here, this is the greater trochanter. This is the lateral hip. Most people when they come in and say, I have hip pain, this is where they're actually hurting, although very rarely is pain out here actually coming from the hip joint. Usually pain out here can be from trochanteric bursitis, from pressure or friction of the iliotibial band as it crosses the greater trochanter. Pain out here also can be radicular from the lumbar spine. Then I'll have Kate turn a little bit further. This marks the posterior superior iliac spine. When people have pain in this area or this area, usually they'll complain of hip pain, posterior hip pain, or buttock pain. Pain here very often is radicular from the lumbar spine, so somebody will have a nerve root impingement accounting for this discomfort. Sacroiliitis can hurt directly over the posterior superior iliac spine, and also sometimes muscle issues like piriformis syndrome, for instance, will hurt deep in somebody's butt, and that will be in this area here. So when I start the hip evaluation, I have someone start facing towards me, and the first thing I want to do is try to appreciate whether their pelvis is level or whether there's a lot of obliquity or twist in their pelvis. I'll put my thumbs on the anterior superior iliac spines, and in Kate's case, they're level. You also want to look at the iliac crest, and the iliac crest is level as well. Then I'll ask somebody to stand on one leg, squat down part way. And when Kate does that, you can see she keeps her hips nice and level. She has good strength of the gluteus medius on the leg she's standing. And now this time I want you to let that other hip drop. So as she comes down here, that's called a functional Trendelenburg, where that hip drops. And very often people with iliotibial band issues, trochanteric bursitis, or weakness in that gluteus medius for other reasons will have that functional Trendelenburg. The next